when doing clinical extraction technique, you're going to either use finger cuts for the fingers that will be doing the extraction, or at least holding the implements or tools. If not, you probably need to go ahead and wear a full gloves. Excuse me. And by law, gloves or finger cuts must be worn when performing extractions, waxing, peeling, microdermabrasion, or any procedure where fluids or blood may be drawn. Do know that the Texas Department of Licensing and Regulation has removed gloves from being required in waxing, but you should know any better. You should know better.
You know, I want to ask you something. What about double dipping? I know this antimicrobial and the waxing and stuff, but they always say, well, everybody does it once you're done.
Well,
can you get diseases?
Absolutely, if there's dead skin or blood or anything, it could still stay within the wax. You can definitely pass on a herpes infection through the wax. One thing about TDLR is that they actually say that double dipping is not allowed, because almost with all waxing comes bleeding.
And I mean, I've heard people say that, well, there's the antimicrobial in the wax that kills the
no, unless the wax is tea tree. They're just probably saying that maybe the heat of the wax, it can't hold bacteria or whatever. Absolutely not. That is no excuse to be double dipping. That's like saying, you need to tan because it stimulates vitamin D in your skin. No, you shouldn't double dip. Absolutely not. It's just not cleanly, and you don't want anyone breaking out. I don't think I've ever broken anybody out from waxing. I think twice someone scabbed because they lied to me about using Retin-A and getting an appeal the day before. And that I can't help. If someone lies, they lie. But no, I've never dipped. I've never double dipped. Absolutely not. It's not. And plus, if you buy those spatulas as craft sticks at MJ Designs or Hobby Lobby, they're $3 a box for 500 to 1,000. The small ones, 1,000 of them for the craft sticks, it's like $3. The other ones that come in like 200 to 500 are still $3. The bigger ones. Okay, I'll do that because no. Waxing is one of those things. Plus, when you start becoming, when you become a medical esthetician or you do clinical level aesthetics, you really do stop waxing people because the procedure just because the procedures that you do is thin down, if not remove the stratum corneum in its entirety, which make waxing now a dangerous thing. And so I always tell people, good skin or waxing. But I usually don't do a lot of waxing on people once, especially if they're on different Tazarac, Retin-A, Accutane, any of that. Absolutely not. So, yeah, you're not going to be doing a lot of waxing if you're doing a lot of chemical resurfacing. All right? So finger cuts. I do like nitrile gloves myself, but you can use latex, vinyl. There are some people that have a latex sensitivity, and if they have a latex sensitivity, you can't be wearing latex either because the latex, makes their skin erupt or itch. I just tend to think a lot of people think that they're allergic to latex because the powder inside some of them might make you itchy. But there are some people that are truly allergic to latex, and those people, need to be careful with rubber masks and anything rubber or latex. But I like nitrile the best, but vinyl are fine too, and I even like latex too. It just depends. I've used all of them. I like them all. But the best protection against the spread of disease is to keep yourself and your surroundings clean. That's even more important than gloves. Gloves are a secondary precaution and does not replace thorough hand washing, okay? So gloves should be worn when doing extractions or any procedures to draw blood, but that doesn't mean that you don't have to wash your hands. All right, as far as hand sanitizers, I don't know what to tell you. I dislike them. I think they enable people into not washing their hands. And bacteria do become smarter, and they do grow and get larger and smarter and bigger. And so after some point in time, you probably need to switch from an antibacterial soap sometimes to just a regular soap, and then back to an antibacterial soap. Does that make sense? All right, let's talk about levels of you don't have to write all this down, but we do want to talk about levels of decontamination so that you understand where you fall in these categories within your environment. But the third level of decontamination is called sanitation. You sanitize an area, you sanitize a fomite. A fomite is another name for like a chair, a table, something, an object. You sanitize your hands, you don't sterilize them, you don't put your hands in boiling water at 100 degrees for 20 minutes, right? So sanitizing something is preventing any new bacteria, right? And so detergents and water, soap and water, thorough hand washing, right, reduces the number of microorganisms. So third level is sanitation, and the key word is reducing the number of microbes, okay? So a private practice, you do facials, you're in your own little room, sanitation might be enough, okay? Disinfection is going to be the second level of decontamination, all right? And this is not as effective as full sterilization, but it does, it doesn't destroy bacterial spores, but you're not really interested in destroying bacterial spores or having a sporicidal disinfectant unless you're in a hospital setting. And so your tuberculicides, like your barbicide pluses and your wavicides, your biotechs, your anything that's tuberculosis, germicide, viricide, all that, that's going to be